So let's get started today with our partner and community updates. I'd like to invite Roxana from Supervisor Solis's office to give us a quick update about LA County response and updates related to the COVID-19 pandemic.
Hi, everyone. Good morning and happy Friday. And thank you for having me at this meeting. I wanted to start off by highlighting several board motions that were adopted this week related to COVID-19. So this week, during Tuesday's board meeting, we had a motion regarding prioritizing the needs of our county frontline healthcare workers. And what this motion was for essentially is to ensure that we asked the county to assess and collaborate with the state regarding housing options for all first responders and frontline healthcare workers who are engaged in the countywide COVID-19 efforts. And then we had another motion that was essentially in response to Governor Gavin Newsom's on April 14th, he announced and outlined 6 critical indicators that the state would consider before modifying the stay-at-home health officer orders. So our motion is pretty much engaging our public health experts to lead these discussions and ensuring that we engage the business community and labor partners as this task force is developed to see how we can safely reopen LA County. And then we also had 2 motions regarding congregate living facilities. So these facilities have been experiencing high mortality rates. They account for 47% of our total deaths to date. So one of the motions called for increasing testing at congregate living facilities, specifically those in skilled nursing facilities. And then also the other one was to prioritize the health and safety of both those that reside in these facilities and those who work there. So there is a continued prioritization and testing for all individuals in these types of institutions and living settings, including the skilled nursing, long-term care facilities, homeless shelters, and correctional institutions. So the Department of Health Services is now overseeing testing for all LA County with the help of public health and fire. And they're currently working with the state on expanding overall testing capacity in these priority areas, which include the congregate living facilities, the homeless populations, the incarcerated individuals, and those with poor health outcomes that would, whose health conditions and marginalized populations would adversely impact them should they become ill with the virus. So also I wanted to highlight that recently Mayor Garcetti announced that testing would be available for all residents. The county is not there yet. This is only for LA City residents. And although our criteria are in line with the state, it doesn't mean that we won't move to expanding to priority 2 populations, which is the goal. Unfortunately, there isn't enough test kits available for us to move from our priority 1 and test everyone. Also, yesterday, the CDC expanded the guidelines on symptoms for a total of 9, which now include cough, shortness of breath, fever, chills, repeated shaking with chills, muscle pain, headache, sore throat, and a new loss of taste or smell. So if anyone has any of these symptoms, they can also schedule themselves to be tested. And then also, testing is also available to all healthcare workers, first responders, social service employees, utility workers, food supply workers, and other public employees regardless of symptoms. So these categories do not have to be symptomatic. And then we're also testing asymptomatic individuals who are over 65, especially if they have chronic underlying health conditions. And currently across the county, with the help of the state, we currently have 35 testing sites, and we continue working with the state to expand testing in areas of high need, and then also working internally with our county departments to ramp up testing at already existing sites. So these are essentially the efforts that we have going on currently. And in the next few weeks, we'll be working really to prioritize and expand testing, and especially this week focusing on the congregate living areas, since we have currently, I think, over 200 of them that have at least one positive case. Are there any questions?
Roxana, Monica would like to remind us that, or bring to our attention that the city's partnered with Sean Penn's nonprofit to provide free testing as well.
Mm-hmm. Thank you.
Any other comments or questions for Roxana? Well, thank you so much, Roxana, for that update on what's happening in our county and community and the opportunities for testing for individuals. We know that's an incredibly important aspect of managing this pandemic.
Heather, there's a few questions coming in through the feed, but also, since I have the stage, just wanted to thank your office, Roxana. I know a few weeks ago, we had few sites in our district of SD1, and just want to appreciate that your team has been working so hard to establish sites all over, particularly SD1. So just thank you so much for that. It makes a difference when people have an access point that is of close proximity to their home.
Definitely.
So the first question we have in the chat room is, has there been a modification to use of PPEs for nursing home staff and health monitoring for residents and staff? In other states like Texas, it was learned that many staff members of nursing homes worked part in various facilities and then spread the virus. So any address on these issues?
So what I do know, at the Department of Public Health, this whole week, they've just been going to all of these nursing homes and congregate living areas, and have prioritized them for their PPE and are testing them through this weekend. I know the city also provided some kits for public health to use to further expand efforts on these types of facilities. And then they're also going and testing individuals who work there as well, including residents. And then also I know that they're, as people are entering, taking their fever and just taking these extra precautionary measures, because it is concerning that almost half of our deaths, 47%, have occurred in these types of institutions. And to further say that in the beginning of this crisis, we were, told that, if you were asymptomatic, it wasn't really an issue. And then later we found that there's people that could spread the virus that are asymptomatic, and that is what's been happening. And so now these are the precautions that are being taken, and then also increased testing. They're currently the priority.
Thank you. We can thank Adi for that question. Vivian wants to know if we have much testing in Boyle Heights. She hadn't heard any updates. And Monica responded to that saying there's testing across the street from Mariachi Plaza, but do you, Roxana, know if there's any other testing going on in Boyle Heights?
So that in Boyle Heights was an area that was identified as an area of need by the state. So we are currently working to open up a site that, will be maybe not necessarily in Boyle Heights, but very close proximity. Again, the ones that are funded through the state are different because they're not necessarily drive-up sites. You still have to make an appointment, but they're in a building and you still test yourself. So yes, there is a need in Boyle Heights, and the state has, identified Boyle Heights as one of the areas of needs, and will continue to identify sites, and the county will continue to work with the state to open up testing in those areas of need, but also ramp up testing in our other bigger drive-through testing facilities.
Fantastic, thank you. Another question from Yolanda wants to know if there's a COVID-19 website by zip code.
I haven't seen a map for by zip code, but I have seen a map on the testing site that shows where all the testing areas are, but not by zip code that I'm aware of. But usually it's interactive, so if you put your address, it kind of tells you what is the closest one to you.
Great. Any other questions at this time?
Anna, did we read the question from Audie?
It just came through my screen.
Oh, there we go.
Yeah, I noticed the daily case report shows cases by incorporated city and communities. However, I resorted by geographic area and was able to see the hot spots. Will county change / provide by supervisorial district or community clusters?
So this information is released by Department of Public Health, and currently the way that they report and show their cases is by city. So, I mean, we could definitely see if there are plans to kind of report differently, but at this time, you know, with their limited capacity, this is the information that's available. They're also have been providing on those press releases, you know, information about demographic data. So that's something else that's been on there recently. So I'm not sure if they'll start changing the way that they're reporting, but definitely something we can bring up to their attention.
Great. There is a comment or a question in Spanish, and I'd like to ask if Rosa might be able to help me with this one. Or Elisa, is Elisa able to?
I don't know if Elisa can go back and forth. While we're figuring that out, there was an earlier question by Audie that asked, has there been a modification of the use of PPEs for nursing home staff and health monitoring for residents and staff? In other states, Texas, it was learned many staff member of nursing homes worked part in various facilities and spread the virus. Any updates on that issue?
Actually, that was the first question that I had Roxana address.
Oh my gosh, I am so sorry. My apologies.
That's okay.
No worries. And actually, I can read the Spanish question.
Okay.
They're pretty much asking if you need to make an appointment to get your testing because this individual would like that Ramona Gardens that they come and do the test there. So to answer that question, you do have to have an appointment. You can have same-day appointments available. And if you need assistance with making an appointment, you can always call 211 and they can help with that. I'm not sure if Ramona Gardens it's not very informative if it's a skilled nursing facility or a congregate living facility. If it is, those are being prioritized, and DPH is sending out their staff to test people on site. For those that have a confirmed outbreak, they just go and test everyone for the most part. That's what they do.
So Ramona Gardens is not a nursing home, it's a housing projects.
Oh, okay. Then they would need to, you know, go to the lacity.org testing that is, you know, shared by the city and the county to make an appointment. Currently, we don't have capacity to go out and test people other than at the skilled nursing facilities where, you know, these individuals live and work. So that would be the update for that.
Okay. Hector Flores shared that the Boyle Heights testing site is drive-through and walk-through, best by appointment. He shared the coronavirus.lacity.org/testing website in order for you to be able to make your appointments. And they're open 7 days a week from 8 to 5. So thank you, Hector, for sharing that link. We'll make sure that we email this link and information out with all of the meeting notes after the meeting. Adi says also there needs to be more context for the cases by community, specifically what is going on in Glendale, and Southeast LA. Why so many cases there? How can we manage spread in those communities?
And for this question, I mean, we can bring it back and to our public health experts. All I can say is that sometimes it could be the type of work that the residents are doing, like if they're working in grocery stores or interacting with a lot of people. I mean, this is just so new and there's so limited information that we can't really know why. What we do know, though, based on the daily briefings that Dr. Ferrer does and the press releases that she releases, there is a higher, rate of spread among African Americans and Latino populations as the second most adversely affected. But in terms of why in these specific areas, I wouldn't know, and I would defer to public health for that question.
Okay. Monica also wants to bring to our attention that there's a testing site in Lincoln Park as well, for anyone who may, where that may be closer to them. And I imagine you can make an appointment for that location through the link or the website that Hector shared with us as well. Roxana, there's another question in Spanish in the chat box if you're...
So that one, I just read it. It's clarifying what Ramona Gardens is. They're saying that like you mentioned, like projects, and that there's a lot of people that live here that are elderly. And she's saying, and she's saying that there's people that don't have access to a telephone and that they're close to 2 hospitals. So that's concerning to them.
Okay.
Thank you for reading the chat box for us, both Anna and Roxana. And Roxana, if there's an additional response you'd like to offer to Juana, maybe you could type it into the chat for her.
Okay.
But I think with this, I'll ask if we've comments. We appreciate your presentation today, Roxana, and I'd like to move forward with the next item on our agenda so that we can be sure to get through our very full list of topics today. And with that, I'd like to invite Deanna Weber of AECOM to join us to speak about the General Hospital Feasibility Study with some updates from the technical team. Deanna? See. Victoria, is Deanna unmuted? She's on a 949 number.
Let me go.
Yeah, she'll need to be unmuted on her phone number.
Hi, can you hear me okay?
We can hear you now.
Hi,
Thank you.
Great. Thanks. We'll go to the first slide, Heather. This is Deanna Weber with AECOM. We're working closely with the CEO's office on the General Hospital Feasibility Study. You can see our website for additional information on this first slide, but we'll get right into the schedule. Our feasibility study for General Hospital, as you can see from this schedule, we've expanded the schedule in essence to incorporate more community engagement and to take into consideration COVID-19, as well as different strategies to engage more folks online. But we're hoping by pushing our next public engagement, our community at large meeting, you can see community at large meeting number 4 in the orange. We're basically pushing that out to mid-August in hopes that that might allow us to have participation from the public. And we're also thinking about safe ways to encourage people to participate, not just online with activities such as today's meeting, but we've also included video clips and other information on our website. So the schedule basically extends now all the way out essentially to March. So we've had very productive working sessions with the CEO's office. We'll be targeting our next meeting with county staff mid-June. Meanwhile, we have every month meetings with our Community Engagement Steering Committee, the CESC, And then, as I mentioned, we'll be targeting the mid-August, probably it would be an open house style format, perhaps, so that we can be available to answer questions and share information, but to not have as many people all together at one point in time. So that's the goal. So we're essentially slowing down the technical work so that the technical work doesn't get ahead of the community engagement. We want to make sure every step of the way we've got the community feedback and engagement we're getting from folks here at the HICP and the larger public. We would be then targeting wrap-up of our technical scenarios and presentation back to the community at large in mid-January of next year. That information will then be packaged into a final report, and that final report will be shared with the Board of Supervisors in March of 2021. So you can see we've extended the schedule, and that schedule extension was basically in collaboration and discussions with the Supervisor's Office, as well as with our Community Engagement Steering Committee. So you can see we'll have monthly engagement at the HICP meetings. We'll have ongoing informal discussions, additional meetings, pop-up events, etc., throughout the course of the project. So I'll pause there just to see if there's any additional questions folks may have on the schedule before we get into looking at the West Campus technical analysis.
There aren't any questions yet in the chat and no raised hands yet. I don't know about those on the phone.
Okay.
So I'd say go ahead.
Great. We'll keep moving. And so we're happy to take any questions on our extended schedule. So just as a reminder, the General Hospital Feasibility Study really is the genesis of the board motion and a healthy village concept. It's really taking General Hospital, bringing the iconic asset back to life. And in this process, to address the county's tremendous need for the homeless, low-income, and high-need population residential options, and specifically in and around the area of the LAC USC Medical Campus. This would be complementing the Wellness Center, and as well as complementing the future restorative care village. It's really mission aligned as housing and a mixed-use building, not just in General Hospital, but looking at the larger campus itself. And this is really rooted and grounded as this foundation and bookend of a healthy village concept. It's really focusing on a whole person care concept to meet all the individual needs so that we can have a resilient, healthy, and economically prosperous community in East Los Angeles to help the most vulnerable populations and to provide recuperative care and wraparound services to empower residents. Next slide.
We do have a question. What is the risk for even more community engagement?
Yeah, thanks, Ari, for the question. So if we go back briefly to the schedule, basically we want to make sure that, we've always anticipated and incorporated, as you know, Ari, lots of community engagement throughout the process. But as you know, we're slowing down the technical work so the technical work doesn't get ahead of the community engagement. So specifically, we'll be incorporating more meetings on a monthly basis with the Community Engagement Steering Committee, as well as monthly engagement with the HICP meetings. Thanks, good question. Okay, so as we look at the General Hospital Feasibility Study, we may ask, what is a feasibility study? Well, it typically is at the very early stages of a planning and visioning process, and it helps us design site plans and begin to think about what the possibilities are for construction. This feasibility study assesses site conditions, technical issues, cost, funding, community and county needs, and ultimately the goal is to produce 3 financially feasible scenarios or reuse options that will be considered by the Board of Supervisors. So the study has multiple opportunities for engagement, like we've talked about, and the technical process is described as we go along in the project website, you can see the address there on this slide. In addition, the proposed reuse scenarios will be presented to the Board of Supervisors, most likely in March of next year, as we talked about in the extended schedule. And then the Board of Supervisors will determine the next steps during this iterative process. Study, assumptions, scenarios, and program are subject to change. Next slide. In the feasibility process, we've talked about what we refer to as the Venn diagram here. This is a diagram that looks at needing to balance the different input and needs in development of the scenarios or reuse options. When we first look at community input and needs and identifying those community input and needs through engagement efforts such as this and our earlier meetings that we've had to date and our future meetings. So a number of priority community needs have been raised so far, including housing, parking, and many other issues. Those community input needs also need to be balanced with the county department requirements as well as technical challenges on the site. So making necessary and extensive repairs to the general hospital building will be important, and it's challenging because of its historic status and the nature of the structure. So the county plans to maintain ownership of General Hospital and the land, and the structures will have future requirements for health services expansion and various department county needs. In addition, you can see in the circle called funding sources, many repairs will need to be made to General Hospital, which will cost hundreds of millions of dollars. So the county currently does not have dedicated funding for this project. So multiple funding sources will need to be explored, including public, private, as well as what we call revenue generating uses. So it's in balancing all of these three needs when you can see in the very middle is the reuse scenarios. Those reuse scenarios will be addressing the community input, the technical challenges, the funding sources, the county department requirements, and then ultimately the Board of Supervisors will determine the next steps. Next slide. So we're going to dive into what we refer to the West Campus area. Last meeting, we spoke about the General Hospital building itself, where you can see labeled on the right-hand side, the General Hospital building and the site around it. It's about 15 acres. Over on the West Campus, which is on the west side of State Street, on the northern side is Zonal, on the western side is Mission, and south is Marengo. The West Campus itself is about 31 acres, but out of that, 12 acres are actually developable because of existing conditions. You can see the medical examiner corner on the western side. We've got the historic pharmacy building that we're looking at a study now, including also the historic tunnel that connects over to the General Hospital building. Also on the West Campus is parking structure P10, the Women and Children's Hospital to be demolished. We also have facing on Marengo, the central utility plant that would be expanded, and then additional areas on West Campus that would be preserved for future health services and land banking. Next slide. So as we look at the technical aspects on West Campus, we first kind of just back up and look at the history of West Campus to understand its current uses. As you can see there in 1894, the building highlighted in red there was the administration building that stands today, the historic building there by the medical examiner coroner. There also was a historic stream on the site, as well as you can see the expansion of the medical campus by the 1930s. Again, highlighted in red is the admin building, and you can see a full medical campus in the plan here. The next image is going to show an aerial picture of what that looks like. So we'll go to the next slide. So the West Campus itself, as you can see on the left-hand side here in 1933, that's when General Hospital opened. You can see the historic pharmacy building and the tunnel with a series of medical buildings and the nurses' barracks in the foreground. And then when you compare that also to today, or 2019, 2020, you can see the different uses that we have on the site. Next slide. When we look at the different components of West Campus and the technical aspects of it, we're investigating really its location, which is somewhat disconnected because of the infrastructure surrounding it. So we want to increase the connections to the community, as well as we want to increase and expand pedestrian access in and around West Campus and effectively connect it to General Hospital and the surrounding community. So we're looking at pedestrian access as well as ADA access. We also want to make sure we improve street presence on West Campus so that we have an opportunity to have a healthy streetscape, a lively space, as well as if we look in the lower left, the landscape areas or the open space, there's minimal open space on West Campus. So we see an opportunity really to use and to incorporate some additional open space, small pocket parks or trails, etc., based on the community feedback we've received. We've also heard of even community gardens would be one option perhaps on the open space on West Campus. The topography, as you know, with General Hospital sitting up on the hill, it's a steep site to get up there from West Campus up to General Hospital. So we're looking at strategies to effectively connect the West Campus to General Hospital. And as you know, there's several projects being developed on West Campus that will be incorporated into our study. Those several projects include the Restorative Care Village Phase 1, the demolition of the Women and Children's Hospital, and then there in number 3, a proposed child care center as well. So in the next slide, we'll look a little bit more detail at General Hospital. In the West Campus, we're able to basically look at incorporating a series of development areas. We call them development parcels, and in those development parcels that essentially comprises our 12 acres of redevelopment. I'm going to pause there to see if we have any questions, and we'll go from there.
Okay, yes, we have a question from Vivian. She wanted to know if we'll also have mental health living as part of the project.
Yeah, thanks for asking. Great question. I'll also invite Kelly Quinn and Ivan Matthews from the CEO's office as well to help address that. Thanks for bringing that up. So we would envision, that concept of a healthy village to essentially have a variety of support services. So in terms of the housing and the mixed use services and community services to support that, we would anticipate health services, community support services to be part of the proposed square footage in General Hospital to complement that healthy village.
Yeah, and Deanna, this is Kelly Quinn. Thanks for your presentation thus far. Vivian, I just wanted to clarify that we don't expect any high acuity mental health housing in General Hospital. The Restorative Care Village is on the West Campus, and that will have some crisis residential housing. But that doesn't mean that there might not be some folks with some level of mental health issues that might live in General Hospital. It's just not designed with kind of higher acuity for mental health needs.
But you're going to at least have a mental health treatments so that at least we can get and help guide a lot of the people that are currently living in the streets without any health care.
Yeah, I believe most of that will be part of the Restorative Care Village.
Thank you.
Okay, we have a question from Adi. Assuming there are many community needs, how will the priorities be identified? And how will the recommendations justify the selected needs to address?
Sure, so
yeah.
I can answer that one.
Go ahead. Thanks.
Good morning, everybody. This is Ivan Matthews. I'm the project manager for the feasibility study. Deanna, thanks for your presentation so far, and Vivian and Ari and several others, thank you for your engaging questions this morning. We have not identified any priorities from what we've heard regarding community needs and services. Through multiple community engagement interactions we've had and multiple additional meetings and the community at large meetings, we've heard a lot regarding what the community needs are, and we've collected a lot of that information. If you've participated in different community at large meetings, we've asked for your thoughts and participation with different sticker exercises, which have been great, and we've taken pictures of all of those, and I'm kind of answering Pamela's question right now too, so I'm jumping ahead a little bit. And we digitized all that into reports that we're going to include back to our Board of Supervisors with the final feasibility study. So we have this collection of community needs, and we're avoiding prioritizing them. And what we're looking at doing is how do we incorporate them into our feasibility study? And maybe we generally allot a certain amount of square footage for community needs and services. And so that's something that we're talking with our technical team about, we're talking with our supervisors team about, and we're going to be sharing with the CESC in the upcoming months before we share with the community at large for thoughts and considerations and input. But we're collecting everything, and we're not prioritizing any of the community needs or services. We're trying to incorporate them all as best we can. And I think as the feasibility study process moves forward and we submit it to the Board of Supervisors, this is just the first step in a large community engagement process to a large redevelopment and reuse of this magnificent county asset. And so I think that these conversations are going to be iterative between the supervisor's office, county departments, and the community, and potential future developer.
Okay, great, thank
Thanks,
you.
great questions. Yeah, and also on the,
Go ahead.
I'm sorry, go ahead.
No, go ahead.
Also on the screen there, Heather's pulling up. When we look a little bit closer at West Campus and we talk about the opportunities for redevelopment, it's exciting that we can look at not just General Hospital, but the context surrounding General Hospital. And in West Campus, as we talked about, we've got about 12, 13 acres of buildable area. And when we look at a finer grain analysis of those areas, we've got basically 3 different potential development areas or development paths, what we call super paths, as you can see in the graphic on the left. So basically, this gives us an opportunity to look at a broader campus solution to be able to address providing more housing opportunities, more mixed use opportunities, as well as still preserving some opportunity for what we call land banking for future health services. We also have a central area where there's a utility easement that runs through there, as highlighted in this image here on the left. The West Campus open space area is designated predominantly because it is a utility corridor. So that may be an area where some of these open space options and ideas we've heard so far from the community might be located. Thanks.
We have from Pamela, 3 communities at large events have already taken place. Lots of good conversations, questions, and priorities were raised by residents. But how is the feasibility study team tracking these comments and storing the feedback?
Yeah, great question, Pamela, thanks. You're absolutely right. We've had great participation at our community at large meetings and a whole series of variety meetings. And we have a tracking process. We've got all of the comments we've received documented. We've also got those categorized. So that information is part of when we think back to the Venn diagram of looking at the community input and the county input and technical needs, and also the financial needs of the project. So that's being incorporated and used by our team carefully to understand what these potential reuse scenarios might look like. So we've got that information, and many of you also participated in community mapping exercises in our last public workshop. So all that's information that we are incorporating in feedback in the development of the reuse scenarios. So thanks for asking that.
And I'll also open this up to Heather and Rosa right now. Many of you may know the foundation is managing our community engagement efforts as of January of this year, and will continue through the end of the feasibility study. So Heather and Rosa, please share any additional thoughts or comments to answer Pamela's question.
Absolutely. Thank you, Ivan. This is Heather. So yes, in response to Pamela's question and just overall how community engagement is being captured and included in the development of the reuse scenarios and then in the final report to the board, we're reaching out to community through the mechanisms already described, the community at large meetings, the feedback that's been received. And in general, we're taking the community priorities and ideas and recommendations to ensure that what ultimately goes before the Board of Supervisors is very reflective of an active community engagement process that really helps us identify and understand what the community needs and expectations are of their medical center campus here on the east side of Los Angeles. So it's a very dynamic process. We have wonderful leadership from our community engagement committee, and we look forward to an ongoing effort in the months ahead as we try to incorporate more opportunities for feedback through virtual mechanisms, as well as the in-person opportunities that we've already been exploring. So that's kind of where we are at right now in the community engagement efforts. Rosa, do you have anything else you'd like to add?
No, I mean, just thank you, everyone. I just want to say, I know that for those of us in community, that are just managing so many needs coming during this stay-at-home order in the post-COVID era, it's, I can imagine that there is a pronounced need that we are all managing and following and looking at how it is that this type of asset can support that process. So I think that it will be important for us to look at what we've gathered in the first 3 meetings, but also with this extra time, be able to identify if there are areas in which the feasibility, though it is a more general summary of what could be possible, because without the specificity of a project plan, right, it's always more general. We could specifically, change the way the priorities are identified, or be able to develop a series of most urgent needs for the Board of Supervisors to consider with this plan. So I think we'll continue to track that. We'll continue to have the discussions at this table. And I am working with the CESC and, of course, any of you on HICP that would like to be involved in identifying how in a post-COVID reality we're going to be able to reach the type of population we've been hoping to reach in the last 2 meetings by using different modes of communication and information sharing, so that we can still meet our community where they're at and be responsive to elevating the needs of the community through this feasibility study.
Thank you so much, Rosa.
Also, it looks like, it looks like there's a question from Yolanda. Thank you, Yolanda. She asked, please remind us again when the project could begin, the earliest date, construction based on funding solely, ? So thanks, Yolanda, for asking that. Great question. So as you know, the proposed schedule, which has been expanded, identifies the feasibility report to go to the Board of Supervisors in March of next year. And then based on that feedback and that direction, if the project continues to move forward, there would first be what we would call a pre-CEQA or pre-environmental phase that needs to start addressing some of the environmental studies and various options, considerations for the site. There would also most likely be a selection process as the county doesn't have secured funding for this project, they would most likely go through a developer selection process to team with. The county would always own the land, so it would be a long-term lease opportunity for a potential developer. So there would be a developer selection process. Meanwhile, we would also go through the environmental entitlement process, what we call CEQA, and that typically can be lengthy. It can be approximately 2 years, maybe even a little bit longer. So we would anticipate at least a couple of years before potentially construction could begin. And we could also think about perhaps phasing of that construction as well. You know, perhaps General Hospital might occur first, or perhaps one of the parcels on West Campus might occur first. I'll see if Kelly or Ivan have any additional comments on that.
Yeah, sure. I just want to kind of amplify some of the points. This is Kelly Quinn. I'm the manager of the Master Planning Unit in the CEO Asset Management Branch, and Ivan and I are working with AECOM on this study. And I just want to emphasize that once the feasibility study goes to the board, it will have 3 different options, and the board will need to decide which general option or framework they would like to pursue, whether or not that framework needs further development or refinement, and then direct us to take next steps. We don't anticipate, given some of the items that Deanna outlined around CEQA, et cetera, and an RFP process for selecting a developer, we don't anticipate a shovel being in the ground anytime before 4 to 5 years from when the board directs us on next steps.
Great, thanks, Kelly.
Sure.
There's another question from Adi. Our community engagement committee suggested developing/using an health equity index for use in developing recommendations for the Board of Supervisors. Will we develop a health equity framework?
Yes, thanks, Ari. Great comment. And it's this kind of feedback we want to get from the group and get your feedback. So we will certainly take that back, working closely with Heather and Rosa and the CEO's office to investigate that and look into that further and get back with you on that. Thanks for bringing that up.
Yeah, and this is Heather. I will add that we are actively looking at that topic for our next upcoming meetings, both with the Community Engagement Steering Committee and with the Health Innovation Community Partnership, as we feel that is a really critical component to the entirety of the work of the HICP as we look at how we bring community benefits and community voices into these projects and priorities on and around the campus. With that, I'll ask if there are any final questions, because we are running late on time, and we have Jorge Orozco, CEO of the LAC USC Medical Center, ready to speak next. So if there are any final questions on General Hospital feasibility study, please add them to the chat and we'll try to respond to those privately. But I'm going to move the agenda along to our next presentation. So give me 1 minute. I have to get back to my right slide deck, but with that, I'd like to speak with us about the impacts of COVID-19 on the LAC USC Medical Center campus. Jorge, you ready to go?
Ready. Can you hear me?
Take it away. We can hear you.
Okay. Good morning, everyone. Well, we made it through the month of April, and we will make it through the month of May. It's been an interesting ride. First, I just want to recognize our amazing staff who on a daily basis come to work and dedicate themselves to making sure that our community stays healthy. They have really stepped up and are doing an amazing job. I want to share few statistics of what's going on here, and then really open it up for questions. Happy to answer any questions. We currently have 67 patients with a diagnosis of COVID-19 in-house. Our hospital is overall is about 60% capacity. So we still have bed capacity. Where we are challenged is in our ICU capacity. These individuals are very, very ill. And so of those 67, we have 24 in the ICUs, and our ICUs are about 85% capacity. So we're getting full there. And what we've seen generally in LA County is reflected here. LA County has been successful in flattening the curve, which means we're continuing to receive 1 to 2 cases a day. What we're finding is patients stay 3, 4, 5 weeks in the hospital, which is a long time. And that's what's really causing the bottleneck in our ICUs. So we have plans if we need to open up additional spaces and bring in additional staff for ICU. But that's essentially where we're at. We have been able to discharge 149 individuals who have been admitted to the hospital with COVID-19 back home and into their communities. So I think the amazing work that our staff has done is really reflected in those lives that have been saved. Our emergency rooms continue to be relatively quiet, which is concerning in that the community has foregone maybe coming to the emergency room for very serious conditions such as heart attacks or strokes that we've seen across the community not coming in. So if you all can help send the message, if you are really ill and need to come to the emergency room, we are here, we welcome you, we are safe. It's a safe place to come and receive care. On the outpatient side, we continue to expand the telemedicine visits that we are doing. So close to 80% of our outpatient visits are being done over the phone. And there are about 20% of those patients continuing to come in for care. This has been a great learning opportunity for our organization in that it really has reflected a different modality of delivering care, which is very convenient for the patient. And we're finding ways to ensure that the quality of care remains high. We have plenty of personal protective equipment. The community has been great in providing meals for our staff, providing donations of personal protective equipment. And so we are doing very well in that respect. Let's see.
Jorge, we have a question in the chat box.
Okay.
Reads, is LAC USC Medical Center moving forward with other surgery and treatments? I've heard hospitals are getting a financial hit due to lack of other surgeries. Is this an issue at your hospital?
Yeah, it's not really driven by a financial consideration. It's really driven by this pent-up demand that we have caused by canceling elective surgeries. We are now moving into the first phase of reopening up our elective surgery and visits, and it's guided by certain principles. Principles such as the first phase, these are patients who don't require testing for COVID-19, don't require additional personal protective equipment, and are issues that need to be resolved in the near future. So we're actively planning to start opening up slowly our elective surgery capacity. We are going to be watching this very carefully, and as our community goes through these ebbs and flows of opening up things and then maybe needing to backscale, it's the same thing with our surgeries. If the stay-at-home order is lifted on May 15th, we may be hit with another surge, and we may need to scale back on these things. So it's a very dynamic, fluid process where we're meeting on a daily basis to monitor and to make decisions.
Great, thank you so much, Jorge. Are there any additional questions for Jorge before we send him back to his frontline responsibilities?
Juana wants to extend her gratitude and her thanks to Jorge and his staff for all of their efforts. And she's just so grateful how well you're taking care of the community.
Thank you. Thank you. I did want to point out that, you know, this is a challenging time for our staff, and many have requested housing options during this time. They don't want to go home to their families, or they live with elderly parents. I'm happy to report that we have housed over 200 of our employees in hotels and local hotels free of cost. USC has generously donated 30 rooms free of cost to our employees. We also have access to the Biltmore. We also have a program through the state and other professional organizations that are offering this housing. So that has been very helpful for us.
Terrific. We have one final question from Kelly Quinn. Any updates that you've heard about the stay-at-home order being lifted?
You know, there have been talks about the need to start opening things up. I mean, the economic impact of the stay-at-home orders are pretty severe. And so I know the state has put out guidelines for moving from where we're at now to a different stage, and testing has a lot to do with the availability of testing has a lot to do with that move. So there is active movement to try to lift those orders. That we may make that in a couple of weeks, depending on how quickly testing gets expanded, but we may not. And I think the move is going to be, let's open up things that can continue social distancing, that can continue to allow our citizens to be safe and not create a huge surge in our community.
Great. Well, thank you so much, Jorge, for your time with us today and for those updates. I think everyone on the call is very, very appreciative of the incredible work that you and your team are doing, and are so appreciative of you taking this time to update us on the status and to continue to be such active participants and supporters of the Health Innovation Community Partnership in this incredibly interesting and novel time.
Yeah.
So with that, thank you. We will, I think, move on to our next subject. I'd like to invite Pamela, August, and Ruby to share with us some updates on the USC Community Benefit Agreement. So Pam and Ruby, Victoria, are they unmuted?
Yes, they are.
I'm not hearing you, Pam.
On another number, maybe?
Oh, there you are. Wait. Oh, no, I'm not hearing you, Pam. I'm so sorry. Is Pamela, are you calling in on a phone number? No, I'm sorry, we're not able to hear you. It doesn't look like you're muted on our end, but we are having difficulty hearing you. Yeah, I'm just not getting any feed from your microphone right now, unfortunately.
Hello?
Oh, there it is. You're
Can you hear me now?
Yep, you're good.
Okay. I had to switch headphones because my other ones died. I'm sorry. Good morning, everyone. And okay, happy International Worker Day, first of all, to all of you. Today, for the next 15 minutes, Ruby Rivera of Legacy LA and myself. We will also be joined by USC's David Galavis later in our presentation. We want to share with you updates about this community benefit agreement that Eastside leads alongside Legacy LA, but Eastside leads partners have held for the past year between USC Health Science Campus development of 95 units of graduate student housing and the lead developer of that project, American Campus Communities. As part of this, a reminder to those longstanding members of the HICP, this is a follow-up to a presentation that Eastside Leads made last year in February, just as soon as we had signed this agreement, to share with all of you about our community engagement process, right? And what are the community priorities as we were reviewing that process. So again, for some of you, the beginning part of our presentation will be a recap and also an update. For the majority of you that are joining us for the first time, well, please, I look forward to you hearing this presentation. Next slide, please. So here's in the presentation overview. So why did Eastside Leads engage in this community benefit agreement process? That will be covered by Ruby. A timeline and community engagement and findings will be covered by Ruby as well. Community demands, what were we hearing in this process? And then agreed conditions of approvals between American Campus Communities, Eastside Leads, and USC. That will be covered both by me and Ruby. Progress and lessons learned. This will be the space that we invite David or any member of USC to share alongside us what has been the process and lessons learned. And then next steps. Next slide, please. And Ruby, I give it up to you.
Thank you, Pamela. So good morning, everyone. Ruby Rivera with Legacy LA. So why the appeal? We began this process even before construction began, with conversations in the community around the fact that that we believe that all development must be guided by the needs and priorities of residents. We are seeing so much in our East Side communities, as well as other parts of Los Angeles County, that development without inclusion of community needs leads to displacement and gentrification, and the negative impacts of gentrification on our community. And all development must guarantee community benefits for local residents. Residents must be informed of any development and investment plans in their community, right? So thinking about the timeline, next slide, please. So for us, this process all began in June of 2018. Where a resident found a notice of a city hearing to discuss some permits for the graduate student housing construction. And they were shocked because they didn't realize that this was even happening. They were scared, they didn't know what was going on. And so we decided to take action and show up to the hearing and ask for more community engagement in this process. So we started there, and we held a few community meetings, one in Ramona Gardens at Santa Teresita, another one in Legacy LA, where we were asking, and then we did a few with youth leaders where we were asking them what they would want USC to, what kind of benefits they would want USC to bring to their community as a condition for their development. So some of the resident priorities that were brought up from June to January 2019 in this conversation was contributing to and/or establishing an affordable housing trust fund to develop housing for extremely low-income residents, hire local and hard-to-employ residents from the surrounding LAC USC area for all income and skill levels and in all occupations that developments in the campus provide. Agreed to a 50% local hire for construction and permanent jobs, including training workshops, jobs for youth, living wage jobs, and union jobs. Allow community members access to all amenities provided by the development project and the USC Health Sciences campus. And so this included free Wi-Fi, free parking after hours at the San Pablo parking structure, access to university shuttles at no cost, and use of the business center and study rooms. USC invest in local tech infrastructure for Ramona Gardens to have access to fast and free internet. So these are some of the priorities that came about and became part of our ask. And with Yeah, and so the way this process worked too was a lot of conversations and negotiations led by Eastside Leads with the work of Pamela and other partner organizations such as Inner City Struggle, Self-Help Graphics, Public Council, Legacy LA, Latino Equality Alliance, in making sure, and East LA Community Corporation, in making sure that we try to create like accountability. And the reason for this is because for many years, there's been construction and development that happens in communities like Boyle Heights and like Ramona Gardens without any consideration to how institutions can be good neighbors, right? And so we wanted to make sure that USC, who tries to be a good neighbor to communities that they are adjacent to, is listening to what specifically the community needs. And with that, I can hand it over to Pamela.
Thank you, Ruby. So actually, I will, in just a few moments, ask Heather to go back to the slide, but it's okay that we stand here. Part of the agreement of the final community benefit agreement that was signed between American Campus Communities, the lead developer of the 95-unit graduate housing, and Eastside Leads, involved creating a space in which an agreed entity would convene. The agreed entity was going to be chosen between American Campus Communities and CD14. Well, in that process, USC Civic Engagement and Government Relations became the body that would convene all actors to ensure that we were moving according to the agreement. These are all the partners that in this process have been brought to the table. The Boyle Heights Work Service Center, Legacy LA, Eastside Leads, Barrio Action, El Centro de Ayuda, and East Los Angeles Skills Center, right? So these are the partners that meet on a monthly basis to ensure that the benefits that were secured in January of 2019 are followed through. So if we can go back to the slide, the back one, that one, thank you. This is what the community, as you heard, community really wanted 50% local and targeted hire. That is not new to partners here in the HICP, where already you have heard that our restorative care village is well underway in meeting 50%. It is possible. For this effort, though, it is a smaller development, but that's where the community began. The agreement ended up being 25% of total construction jobs on the project. 10% of those construction jobs would be deemed disadvantaged workers. For county agencies, or for those of us that have been part of HICP since 2017, we know that the county calls it targeted hire. In this case, it's similar, right? Household income below 50%, is a youth that has probably been part of foster care youth, is receiving public assistance, a single parent. So I'm just putting the context, right? Targeted hire criteria falls under disadvantaged workers in this agreement. We also agreed to a local procurement goal for from small businesses for construction supplies. For example, that could be copiers, that could be paper, that could be supplies that the construction companies need. We also defined local in 2 tiers. Tier number 1 would be a 3-mile radius from the graduate student housing, which is very close to the LAC USC Medical Center, for those of you that might not be so familiar with the area. Tier 2 would be within 5 miles. So again, we were really excited to see that we, in this process, targeted a much closer area to the east side. The developer, American Campus Communities, also agreed to donate $100,000 to a job training program, which USC Government Relations and Civic Engagement have been mediating those funds. USC commits to a digital literacy strategy, including a mobile computer lab accessible to residents of Ramona Gardens, Boyle Heights, El Sereno, surrounding communities. Now, this information is a USC commit. This was in the letter that Marta Escutia, the Vice President of Government Relations, submitted to Plum as this process was taking place. So just for partners know, the bullet points above are the agreements from American campus communities. The last 2 bullets are the commitments from USC. USC also committed to providing additional services to the Ramona Gardens Library and Ramona Gardens residents. Next slide, please. Again, so what has been our progress? We've been meeting on a monthly basis, again, convened by the USC Civic Engagement Team once a month, very close to the USC Health Science campus. We meet to talk about what has been our progress in local hire, what has been our progress in disadvantaged workers, how many referrals have partners at the table brought to the table and have actually been hired. So what you see in front of you is a March 2020 quarterly report. We get this report from the jobs coordinator, PV Jobs. We know that to date, since you could say December of 2018, there's been a total of 99 employees hired on the project. From the partners at the table, from this year, we've had 5 referrals that have actually, my understanding of this space is that have actually been employed. Like from referrals, they had the right skill set, they met the criteria, they were hired on the development. And overall, PV Jobs has referred 45 local employees to the site. So again, we have a 25% local hire target, 24.88. So we were close according to the numbers that PV Jobs and benchmark contractors are putting together for us. Unfortunately, with disadvantaged workers, you will see that we are way behind, right? Folks that have really struggled to find access to jobs that are really family sustaining haven't been able to be a part of this process. And procurement material, 15%. I do want to add that in this community benefit agreement, if the benchmarks for disadvantage and local procurement were not met, it wasn't going to be a penalty. We were really, it was really more targeted for local hire. Next slide, please. So I also want to add that I will invite David Galavis to share, if he can, more updated numbers to the slide that you just saw. But to our perspective, this is also a space that I'm going to invite Ruby. Lessons learned. I want to touch on the first bullet point, and I'll have Ruby touch on the next one, and we'll alternate. With Eastside Leads and how partners, Eastside Leads and its partners see, meeting consistency has been a good thing. Mm-hmm. Again, part of this agreement has meant that we meet on a monthly basis. USC convenes us and convenes the partners, right? That's meant accountability. We get these reports, we get to ask questions. We even get to ask questions of ourselves as community-based organizations of what has been the challenges to refer and to actually get someone hired. Mm-hmm. Ruby, do you want to touch on the next one?
Sure. So I think what's also been helpful is having a point person to coordinate our communications and the logistics for this. So USC has taken lead in ensuring that they convene us, that there's notes, that there's agenda set, and that we're able to document what's being shared to ensure that accountability is happening.
Go ahead, Ruby.
No, that's all.
Okay. Have partners that can prepare community for the workforce because of barriers to employment. So partners, health innovation community partners, you saw the numbers. Those folks that are considered targeted hire or disadvantaged workers have not been able, to get an economic process into this development. They haven't been able to get an opportunity for employment. We really have to think about why that is. What have been the challenges? I think for Eastside Leads being in this space, we've realized early on, we need partners that can address those, that have an understanding of the community, that have an understanding of what are the barriers to employment. Is it transportation? Is it language? Is it education? Is it the fact that they don't have affordable housing and they're struggling? Are they balancing school and life and now a pandemic? So having partners early on that understand that. Ruby?
Yeah, so one thing I wanted to mention before I hand it over to David is I think the community partners that were brought to the table, those organizations were really key and have been really key in this process, because a lot of, you know, El Centro de Ayuda, Barrio Action, and other folks at the table, they have years of experience working with adults in the community who, when it comes to like workforce development and supporting them in looking for and identifying work opportunities. And one of the root causes that came about in this process as a lesson learned is that when we think about community benefits and local hire, it needs to be like a more nuanced approach where it isn't just saying like 20% of the jobs, the positions will be given locally. It has to be bigger than that, right? Because there isn't necessarily 20% of a workforce ready and available to work in construction, right? And the reasons, the barriers preventing them from participating is not just job training, but other factors such as a few of our youth that we referred weren't able to reach this end result because of drug use, right? And so, and I remember Raul from Centro de Ayuda talked about this a lot, about how that is like a bigger issue, that we almost have like preparation work with community members. So almost like funding to prepare community members to be put into training programs to for local hire and construction jobs. Concern was about development and securing community benefits. It's like, it's not just about saying local hire, but it's also about how do we prepare for these jobs, like all the way from making sure that they're even ready to be a part of training.
Mm-hmm. And I think, thank you, Ruby. And the last point here, partners, is that local is key. You know, we realized in this process that PV jobs are jobs coordinator, although that was also an important component to have in this process. Their training wasn't local. You know, sometimes they had to go to Marina del Rey to get some access to training. And we were all cognizant of that. But I think by the time we learned that, right, it's how many people probably fell through the pipe because they couldn't access that training. But then partners like the East LA Workforce Center, they also have their own workshops, right? And some folks were able to get training, not able to get employed in this development, but at least economic opportunity was created for other individuals. But local is key. For any development, as we think about the LAC USC Medical Center and any further development that takes place in this area, local is key. Have those trainings nearby, have those workshops nearby, orientations nearby. David, lessons learned? Anything you'd like to add so far?
Sure, Pamela, Ruby, thank you both so much. Again, David Galavis, I'm here with my colleague Dulce Acosta, who's on the line. I'm proud to say I'm born and raised in Boyle Heights on Euclid and Lanfranco, right by Matthews, right by Roosevelt, and Dulce's from City Terrace. We're both proud of that fact that we're East Side products. Before I talk about lessons learned, I just want to say, like many of you, our outreach is focused on COVID-19. And at some point in the near future, I know Jorge mentioned what the university has been able to do with County USC to provide hotel rooms to frontline workers. We'd also like to talk to you about the other community partnerships that we've developed over the last month or so. I've been involved in community benefits for 20 plus years, going all the way back to the Staples Center agreement that was done in 1999. I've been working with USC on community benefits agreements for the past 16 years. When we did the USC Village Development Agreement, our local hiring goal was 30%, and we hit 37%. When we did the Coliseum, our local hiring goal was actually 30%, and we were able to hit 70%. And I'll go into the reasons why we were able to hit those numbers and why at this point for our project here with ACC, we're at 24.88%, just below the 25 threshold. In terms of lessons learned, I would say that I think Pamela and Ruby are right. One of the key distinctions between this project and the projects in South LA, and this is no criticism of the East Side, is South LA, and especially with PV Jobs, they have an infrastructure for job training and job developing that we don't have in the East Side yet. I think that's been one of the key lessons learned. We have great nonprofits. We have incredible nonprofits. But in terms of having a pathway where people can get into, can be identified, get into training at either the skill center, the occupational center at PV Jobs or ELAC or somewhere else, and then get into the placement process, that's been challenging, to say the least. So that I would say that's the key lesson learned. And I think our conversations with Eastside Leads and the other developers, one of the things we've talked about is how do we develop a longer term vision for local hiring in our neighborhoods. The second thing is, Ruby touched on this, is the training and the placement is really hampered by a lot of indirect issues, such as transportation, such as people having to, not only currently work for their current jobs to sustain their families or sustain themselves. They can't really take time away from that to go on a training session where they have to pay for it themselves, number one, or number two, where they have to, do that during work hours. That's close to impossible to do. So that's also been a lesson learned for us. Now, in past developments, what the university has done is we've worked with the city to pay for people, to pay for community members to go through that training. But again, that's also been challenging to implement in this case. So we've also talked about the possibility of working with partners to develop like an East area focused PV Jobs or an East area focused, or actually just work more closely with the worksource centers. And I'll talk about the worksource centers in a second. Again, other indirect issues, I hate to say it, but the drug testing issue has been really, really problematic in terms of, especially among our youth who can go into these training opportunities, but they can't pass drug tests. So that's another big indirect issue that we've run into. Immigration is another one. That's a huge one in our East Side communities that we've tried to look at how we can rectify that. The other thing I will say that is positive in terms of that we've learned as a real strong lesson learned is both the city and the county worksource centers, they're such incredibly good partners. And one thing we've learned is they need to be engaged early on because nonprofits are so focused on direct services that it's hard to tell a nonprofit, okay, you're serving people by doing X, Y, and Z. Now we want you to refer them to get training. That's not easy for many nonprofits to do. So the worksource centers, again, both the city and Isidro, we brought your team to this process a little later than we should have, but your folks have been incredible just in terms of helping alleviate the bottleneck at nonprofits. So those are the key lessons learned that we've learned on this specific project. Now I'd like to turn it over to Dulce Acosta, my colleague, to talk about her lessons learned and some potential next steps.
Definitely. Thank you. Good morning, and thank you for having me. One of my biggest lessons learned in just trying to meet the community where they're at and really trying to integrate, which to me was really important, a GED or a high school program at Ramona Gardens, utilizing a empty library trailer that they have there, was finding that a lot of different organizations hold leases to these certain buildings and spaces within Ramona Gardens. So being that the Boys and Girls Club leases the gym, they also lease the trailer. And they were actually open to working with me and actually allowing us to come in here and come into Ramona Gardens and provide a GED and high school program. But then we were stopped by HICP because they actually, although people have access to the lease, other entities like HICP are in charge of the programming. So they have actually a plan to integrate a high school and a GED program, and we were asked to that we weren't able to use it. So for me, the lesson learned was that we need partnerships. We need to continue to strengthen those relationships. We built some really great ones with the Occupational Center, the Skills Center, all the various nonprofits, and being from this community, I'm not from City Terrace, went to City Terrace High School, but was raised in the East Side El Sereno University Hills community, realizing that access to short-term courses are so important, but yet some of the trade schools that surround the health science campuses do not have any funding for our kids to go there. They don't have any financial aid. There's not even a payment plan, right? So there's a lot of barriers. And so supporting the nonprofits with some money to achieve those barriers and to support our youth was really important. So we hope to continue to grow. I know that the Occupational Center just received a GNC grant to train anesthesia technicians from the community. So for me, the lessons learned were tough, but I think the outcome and the continue of the relationships is what inspires me to continue to work with these great people.
Thank you, Dulce. And if we can go to the next slide. I know there's already questions on the chat that we want to address. So again, there's been conversation within this Health Science Campus, American Campus Communities, Legacy, the partners, USC, civic engagement. I want to just frame it with this quote, again, in the letter that Martha Scutia submitted to Plum. The university will use data and analysis gathered in connection with the student housing project to inform further long-term efforts for other projects on the USC Health Science Campus, including strengthening local hiring decisions and additional stakeholders. And David, I know that this already has been the conversation that we've started in the last couple of meetings. I think for Eastside Lead's perspective, this is key. I think we know the lessons learned, we know the partners, we know that labor also probably needs to be at the table. We need to grow these partnerships. We need to, now with the LAC USC Medical Center developments taking place, I pose it to the partnership. How can we build on this process that today we're presenting to you? We see next steps as Eastside Leads collectively removing the barriers to employment. Again, what would it look like for targeted employees, local targeted folks, to actually be the ones benefiting from these projects? Build on this model, partners. We see developing, like ultimately for Eastside Leads perspective, we see a workforce for the region. I also, roadmap to recovery, as I mentioned in my chat, Supervisor Hilda Solis and Catherine Barger, they both put forward a roadmap to economic recovery post-COVID. It is a strong first step. We need more community-based organizations in these places. I hope that you take away with the learnings that having community input, whether that's youth, whether that's your local community, everyone at the table, means that you ensure your development has support. Walk with community. We are facing COVID. We're all living this pandemic, yet not all of us are being impacted the same way. How do we create a just roadmap to recovery for any development or investment that comes to the East Side? Again, we see that as inclusion. We see that as engagement. We see that as developing this workforce. We see that as anti-displacement measures. Ruby, final thoughts, and then David, final thoughts.
So I think one of the big next steps, or what we would encourage and recommend as next steps, is to build on this model. I think that engaging the community so late in this process was also a deterrent. I feel like as folks want to develop near communities, it's important to come into it as a good neighbor and engage community and conversations around community benefits since the beginning, and to really think about how within the resources that, whether it's private development, whether it's institution development, like how can your resources be leveraged to also create opportunities for the communities nearby so that they're not having to deal with the negative impacts of gentrification, the negative impacts of development, such as displacement. And I think it's a real thing. And I think it's this model of the table that was created with our monthly conversations and the solutions that we've been able to find together as community organizations and USC and other local institutions. I think that that's a model that could be built upon as we continue, so that it's not a constant like fight or constant like contention between community organizations and coalitions and institutions and private developers, but how can we all work in partnership to ensure benefits for all?
Yes, thank you. David, do you have one closing comment? I'm so sorry, we're very behind time, so I'm not going to be able to do any questions.
No worries. No worries. Very quick. Just prior to coming to USC, I was a longtime community activist and organizer. And I just would like to say that with my work and the work that Dulce and I, working with Pamela and Ruby and others on community benefits agreements, we'd be more than happy to sit down with if you all are working on or proposing a community benefits with other developers that you're working with, we'd be more than happy to sit down and talk to you about different tools that we put in place and different barriers that long-term barriers that need to be identified and removed. So we'd be happy to have that conversation, folks. Thank you.
Thank you so much, all of you, for such an incredible, in detailed case study of how this can work really well to the advantage of community in partnership with local stakeholders and developers. With that, I am sorry to say that we're not able to take any questions as part of the presentation. We do encourage you to add your questions via chat if you can, and I think we will happily invite this group of people back to do a follow-on conversation on next steps and the process itself per David's offer. But with that, I would like to now move forward and ask our colleague Rigo Reyes from the Office of Immigrant Affairs if he would like to share with us some of the immigrant services that are being made available to our community in this time of COVID-19. We're very delighted that he was able to join us today, and I apologize for the late start of the presentation, but we're very excited to hear from you, Rigo.
Thank you very much. Actually, it was great to listen to my colleagues speak. I learned a lot. Thank you for all you're doing, making sure that there's inclusion and certainly being responsive to the needs of the community. That's certainly at the core of what we do in the Office of Immigrant Affairs. So many of the things that were said reinforced what I was going to say, and certainly informed more so some things that we have learned in responding to this nightmare that COVID-19 has created in our communities. Three things that I want to cover just quickly, and I know that you're running behind, so I'll be brief. One concerns the outreach approach many mentioned before about meeting our residents where they are. So that is very crucial. Certainly, we want to make sure that when we reach immigrants and their families, we take a systemic approach to ensure that they learn about and have access to wraparound services. Not just the service they come to us, but to understand what the county has, like we say, services from the womb to the tomb, so that our communities know, certainly addressing concerns immigrants may have about the impact that receiving such services may have on their immigration status. And thirdly, the issue that in order to connect with our immigrants and their families, we have to use trusted sources, trusted partners such as yours that have been in the community, work in, day out, where their messaging actually influences behavior in regard to how immigrants and their families respond. So in regard to outreach, getting back to point one, I just wanted to say that, I mean, clearly the social distancing and all the issues that came along with COVID-19 forced us to look at other ways, like what we're doing today. And, you know, ironically, this works way better for our immigrant communities. And our Office of Immigrant Affairs had embraced social media, Facebook, and, you know, to leverage our connecting with the community. We were very aware that folks are scared about immigration enforcement, and certainly had experiences when we would spend a lot of time working with partners, organizing an event, just a simple Know Your Rights event, for instance, that we did in Catalina Island. We got there at 7 p.m. to accommodate for schedules, had the attorneys, had everyone, and only a handful of folks were in the room. It was very telling that some kids would come in the room, then they would leave, and then the parents would come in. And they were that concerned that it was some sort of a setup where immigration officials would be waiting for them. So utilizing social media and what we did have done over the last 5-6 weeks, we have been hosting with Supervisor Solis a weekly press conference for the ethnic media and the community stakeholders who are those trusted messengers again, so that we can educate the community about the services in a wraparound manner that the county has in order to get them to get through this pandemic. So what are those wraparound services? You know, that's the topic of today. What have we been providing to our communities? And again, this we hope to get representatives from the various ethnic media outlets so that we reach into the various needs. Issues that have to do with workers. I mean, clearly workers losing their jobs, particularly those who are undocumented, who don't qualify for the federal CARES Act relief, and certainly for most any other government-related you know, benefits. It's you know, worth noting that workers, irrespective of the social their immigration status, may be eligible for disability insurance claims. They can also qualify for workers' comp and paid family leave. Unfortunately, employees who don't have authorization to work and a social security number will not qualify for unemployment. But we want to make sure that they know those other benefits may be available, and certainly they should apply rather than self-disqualify, to make sure that they know whether they can get something of help. Tenants, it's another huge issue. Last month, 1 out of 3 tenants wasn't able to pay the rent. Today's rent day, we know that many people will not make the rent. So the county put in place some regulation where they temporarily banned evictions due to the tenant's inability to pay the rent. This motion by the board, it was retroactive. It applies from March 4th through May 31st. And again, it makes it very easy for a tenant to notify the landlord that he or she will not be able to pay the rent, and then the landlord may not try to evict them. Now, that does not waive the payment of the back rent. So another protection the board put in place is that any tenant who falls behind on paying the rent during this evictions ban, the first, the tenant has up to 2 months to catch up with back rent, meaning that from May 31st of 2020, when the emergency ends, unless it's extended, the tenant will have up until May of 2021 to pay the rent. That is a huge relief for families to know that one, they will not be evicted, at least during this emergency situation, and that they will have up to a year to catch up with rent they fell behind, and that the landlords may not assess penalties, interest on the past due rent. The other thing that in regard to tenants, there is a rent freeze, and so certainly that would help those who may be struggling to pay the rent, but I mean, certainly getting a pay hike, a rent increase is not going to help. The other thing, I mean, that's basically, you know, in your wheelhouse is the health care situation. We have to look at all these things through the lens of the immigrant and his or her family. We're on top of the pandemic fear that is going on in the community. They also have this fear that if they receive public services, that will impact their immigration status because they've been hearing all these issues with public charge. So we need to remind them that all these services, all these protections apply irrespective of immigration status, and that for the most part, they are not impacted as far as public charge is concerned. Certainly receiving treatment, receiving testing, receiving preventative care in regard to COVID-19, the feds were very explicit. It will not be used against the public charge test. So we've had your good friend, colleague, Anna Gorman from My Health LA participate in our press conferences more than once. Actually, yesterday, we do the press conference every Thursday at 2:30. She was there again, reminding folks that My Health LA is available. Certainly no one should go without getting the health care that they need. And that is not just COVID-19 related. That certainly once they enroll in My Health LA, they can get referrals to mental health, to some other more long-term type of urgencies that the communities have. The last item that we've been very concerned about is just basic food, safety net, assistance that these families need. Again, they did not qualify for the federal relief. So we have engaged closely with the Department of Public Social Services. Yesterday, Antonia Jimenez, the director, was at our press conference explaining things like CalFresh. You know, in fact, May is CalFresh Awareness Month, and so on, so that these families get the help they need. One thing to remember is that many of these families are mixed immigration status. So even if one member of the household said mom or dad doesn't qualify because of their immigration status for some of these benefits, the kids or other members in the household may be eligible. So we don't want them to self-disqualify before they even ask us. So we want, obviously them to call our Office of Immigrant Affairs. We can walk them through the process. We can tell them, what's available, and if you have any questions concerning their immigration impact, certainly there to help. Our number, and I had sent some of the links to our resources. Thank you for putting them on the screen. We have some FAQs in several languages. But really, if there is any concerns, our number, our website may have the answers. And if not, we can certainly find out and connect them. And lastly, I like to remind everyone that the county in our department and several other departments set up this disaster assistance center. It's a a center that sort of a one-stop shop for folks to call. The services that they are very trained about are worker concerns, worker rights. They can explain to folks how we can help them, what benefits they may be eligible for. We also have information for small business owners. Many, as you know, in our communities, by necessity, are small business owners. We want them to call in to see what resources are available. The other major reason to call there is anything that has to do with landlord and tenant issues, including disputes when these folks may be facing an eviction in spite of the protections in place. And another major area that people can call us that we're beginning to see an increasing urgency is foreclosures. As you know, a lot of folks are going to start having a really hard time paying the mortgage. We have had a program in place in our Department of Consumer and Business Affairs for something like 15 years, where we have a division that helps people prevent foreclosure, negotiating with the banks, making sure that they get the help they need. So the phone number for the center, it's in the FAQs I sent, but I'll say right now, it's 833-238-4450, and it's easy to remember, Disaster Help Center at lacounty.gov. We have about a dozen languages, and we can connect to others if needed, because again, we want to make sure that in the Spanish-speaking community, the Tagalog-speaking community, Kamai, that everyone knows that we're in this together, and certainly once we put our thoughts together, we can make a difference. So I'll stop here. I have 5 minutes before I have to jump on the call. If there's any quick questions that you have for me, I'm glad to answer them, or I can provide responses later.
Thank you so much, Rigo. We appreciate your flexibility today and your time with us. There are a couple questions in the chat box. I wonder if you might be able to respond to them via chat. Otherwise, we can follow up with you and get a response that we can send out via email to everyone on the group. We do, as you noticed, have only a few minutes left on our time today. And I wanted to be sure to give a moment to our colleague Isidro Villanueva of WEDAX, who was going to give us a much longer presentation on local and targeted worker hire today. Unfortunately, we're not able to dig in as deeply as we had hoped today. So we will postpone the majority of Isidro's presentation till the June HICP meeting. So with that, Rigo, thank you so much again for the time and the wonderful resources that you're providing to the community. I personally have looked at the resource guide. It's an incredible wealth of information, and we're actively using it and connecting community members to those resources. So I thank you very much for that. And like I say, if you could take a quick look at the chat, there's a few questions for you that you may be able to respond to directly there. Thank you. With that, Isidro, are you ready to go and in lightning speed give us a few updates from WEDAX and from the local and targeted worker hire program?
Yes, good morning. Thank you. Yes, I'll move through the slides quickly, or I'll just share a few slides. I want to go back and thank Pamela and David for their presentation. A lot of the information that they shared definitely I can learn from it. I know Alicia Ramos and myself have reached out to David and had conversations with his team to kind of learn from their lessons learned and best practices. So thank you to them again for their presentation. But quickly, Heather, if you want to move forward with maybe the next that slide, just give an update on the local worker hire goals for the projects of the Women and Children's Hospital, phase 3, and then the restorative care village. As you see there on the screen, both projects are above the 30% required goal. The Women and Children's Hospital is at 70%, which is well above the 50% aspirational goal that was set. The restorative care village is at 42%, so just a little below the 50% aspirational goal, but definitely well above the required goal of 30%. And then you see there the hours that are attributed to those percentage goals. I will ask Alicia Ramos to share with me. I know some of the information is limited, but at least the zip codes and maybe the trades of those local workers, so we can report out to at least the subcommittee so they can know. I know there's a big interest in knowing where these individuals are from, especially from, I think it's a 2-mile radius that people want to know whether these people are from. So I'll be asking Alicia to share zip codes so that we can again report that out to the group. So Alicia, I don't know if you're still on the call or in the meeting. I don't know if you
Yes,
have
I am,
anything to
Isidro.
add to this slide.
Yeah, thank you, Isidro. I just wanted to basically reiterate the numbers that you see in front of you. We're doing very well on women's and children's, and we are going to be looking at Restorative Care Village closer to see how we can increase that number as well. But not bad numbers, but obviously we want the 42% to increase as well. So we've been working with WEDAX to basically keep track of how we're performing, but we are also, I want to make sure that we're also aware of the targeted worker component. And as was stated earlier,
Sorry, so Heather, if you want to go to the next slide.
Yes, thank you, Isidro. So targeted workers, we are realizing we're not on record meeting these goals. And that is something that is giving us concern for a number of reasons. One, the targeted worker component is a very important part of inclusivity and getting these folks back into a cycle where they can be productive and also be given the opportunities that sometimes aren't afforded to them. But in our conversations, we know that this is a sensitive topic because a lot of folks, this is not something that they're terribly forthcoming with in terms of criteria that could qualify them for targeted workers. And my sense is that we may have some targeted workers on our projects, but because the nature of information can be sensitive, that they may not be coming forward with it. So Isidro and I have committed to have more conversations and to work together to see what we can do to specifically get some benefit here for targeted workers. So we'll be coming together with some collaboration and hopefully get these numbers up where they need to be, which is at least 10% is what we'd like to see. I also want to touch a little bit on an effort that is ongoing right now with WEDAX and all the county resources out there. The county has a number of ways to incorporate community more. But what we are noticing is that there are some gaps in that pipeline, if you will, networks where we think we can be more efficient and we can increase community opportunities. So currently there is a jobs developer scope of services that is under evaluation. And I want to at least put that out there as information that we will come back to HICP and let you know how that effort is going. Essentially what the jobs developer would do is help us assist with finding the gaps in our network. How do we get more community involvement? How do we track those community members to see, as was mentioned earlier by Pamela and Ruby's presentation, what's keeping people from getting into the pipeline of labor? Is it because they have some unique circumstances that are keeping them from giving their participation? It could be because of lack of childcare, lack of transportation to training, or that they have jobs right now that they need in order to pay the bills, and taking a break from that to retrain for a new position can be a very precarious situation for them. So just want to give you a heads up on that. We are evaluating proposals right now to bring on a jobs developer to help us with that aspect of improving our ability to incorporate the community. So with that, Isidro, I'll hand it back over to you.
Great, thank you, Alicia. So really quickly, so you see there on the screen, 0% at targeted workers for both projects. And obviously you heard some of the challenges also presented by Pamela and David and their work group. Heather, if you can go to the next slide. I just wanted to mention to the group that we'll be reconvening the subcommittee that looks at the local worker policy, and then also just workforce development in general. So again, just kind of like Pamela and David mentioned, there is a lot of work that needs to be done by all of us. So in regards to the targeted worker, here on the screen, you have what qualifies individuals as targeted workers. So if everybody can kind of help identify maybe one or two people under these categories that maybe we can refer over to these projects. And again, like Alicia mentioned, I'll work with Alicia and her team to see if we can get any targeted workers on these projects. And maybe like I said, there's an email going around with some possible dates on reconvening the work group, the subcommittee group for the local hire. So maybe at that meeting, we'll see if maybe we can come up with maybe just a few individuals that fall under these, one of these categories, so that we can, maybe refer, and then again, like David and Paula mentioned, maybe get some more resources behind them to ensure that they are successful, once they are referred, and hopefully once they are employed, that they stay employed. The last thing I want to mention quickly is in regards to workforce or actually training in the region. Earlier this year, at the beginning of the year, we did partner with the East LA Occupational Center. And they developed, or they put on what they call a multi-craft core curriculum training program together for us. And the importance about that training is that that's a training that was directly developed by the union trades. So in partnership with the LA and Orange County Building and Trades Council and their nonprofit arm, which is the Apprenticeship Readiness Fund, they conduct these trainings. So they put in a training program that started in January. Unfortunately, the training ended literally the week that everything was shut down. But again, that's going back to the need for training in the region. And then also just to know that I'll be reaching out to that group to see if, again, we can identify any targeted workers. If you have any questions, you can email me or you can put them in the chat box and I can respond to them later. If you haven't received an email and are interested in being part of that subcommittee work group, contact me or Rosa or Heather, and we'll make sure to invite you to the meeting. Again, I apologize that the meeting went late and I couldn't share more information, but I'll be sharing more information at next month's meeting.
Thank you so much. Thank you so much, Isidro, and appreciation for your flexibility today. You and Alicia both, that we were unable to get through everything on your presentation, but I wanted to note to people that the entire presentation that Isidro was going to give will be posted on the HICP LA website, and we will give him more time next week, or next month, pardon me, to reflect on the jobs coordinator position, employment numbers, and the resiliency fund for dislocated workers, as we convene our HICP subcommittee on local and targeted worker hire. That subcommittee will be meeting in the next couple of weeks. If you are a current member, we're delighted to be reaching out to you. If you are interested in joining that subcommittee, please do be in contact with Isidro, myself, or Rosa Soto, and we will make sure to connect you to the organizing group of the committee. That, I think, concludes us for our May Health Innovation Community Partnership meeting, and we're very excited to continue our work together. Our next meeting will be on Friday, June 5th. We anticipate hosting that meeting virtually again, so appreciate your patience with us as we find our way through this Zoom opportunity. We have a poll that we're going to offer for those that have stayed with us through this entire meeting time, and we thank you so much for your participation. We also offer up the chat room for leaving any comments about this meeting and ways that we may improve it going forward. What was most resonant to you? What would you like to learn more about in future meetings? Please feel free to put that in the chat. We will be consolidating the chat and posting that on our website alongside the presentation and the recording of this meeting as well. First up, we wanted to check in with everyone on how informative this meeting was for you. Please feel free to answer on a rating of 1 to 5. 1 being low, 5 being high. How informative was today's meeting? All right, we'll move on to our next question in the poll. Victoria, thank you. What might be done differently for future meetings? Time allocation for each topic speaker, more time for Q&A, the flow of the presentation. If you have a recommendation for where we might dig in, please do note it here. Thank you again for your feedback. We will be looking at that more deeply. And thank you again for your time today. I hope it was a useful meeting to you and gives you a lot of good resources, tools, and food for thought. We look forward to continuing our work together and invite you to visit our website at www.hicpla.org for this and future updates. Thank you and have a fabulous Friday and weekend.